What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. I'm Bryan Brozy, joined by my friend and co-host Keoni Tita. Keoni, how are you today?
Doing good. I'm excited about this one. This is something I don't really know too much about.
So I wanted to have a real short, sweet conversation about a concept, virtual surgery. So being in the clinic, I'm seeing a lot of people who have had surgery or kind of considering a second surgery or their first surgery. And a lot of times, especially if it's a chronic pain, so I'll kind of use some examples here. So obviously there are times when surgery is kind of foregone conclusion is obvious, right? We're in a car accident. We have some sort of like burst fracture to our humerus or a very, very severe type of injury where we need like an immediate surgery. I'm thinking motor vehicle accident where your spinal cord is injured or your vertebrae breaks and there is something that we immediately need to fix and kind of take pressure off for the sake of your life. So that is not necessarily within the confines of should we consider this concept virtual surgery that I'm about to introduce. For most of what I'm talking about, the achy neck or the achy arm or the achy low back is a great example, or just these sorts of things that aren't, maybe they waver, right? Maybe some days we're in a 9 out of 10 pain, 10 out of 10 pain. Maybe some days we're in a 2 out of 10 pain.
right.
And that helps kind of tell us that, hey, this is fluctuating. This isn't like one of those emergency instances where, for instance, you're in that motor vehicle accident, you put pressure on your cauda equina, which is the end of the spinal cord. Very dangerous situation for you to maintain pressure on your spinal cord. As you could imagine, we immediately need to remove that for the sake of your well-being for the long term. Not necessarily the same if you have low back pain and the doctor is possibly talking about like a discectomy, which is where they kind of cut out little pieces of the disc that may be putting pressure on structures that are giving you pain, or like a fusion where maybe they're talking about the two vertebrae are moving too much and they're shifting and that can be giving you pain. Sometimes that could be one of those instances where if it is putting pressure on the actual spinal cord, that's one of those instances where we really do need to make sure that doesn't happen for the sake of your life. But if we're getting little shiftiness that is just putting pressure on nerve roots like sciatica, where it's kind of running all the way down your leg, and again, it comes and goes, it fluctuates. So it's kind of the first sign that we could even possibly consider this virtual surgery theory, because it's all about, obviously it's fluctuating. Things are changing. There's a mechanical cause and things we can do to disrupt the pain and make it better, make it worse, and so on and so forth, which means we can treat it without having to go under the knife in theory.
And these things aren't necessarily where the doctor has said you definitely need surgery, right? This is just a way to kind of.
I would say yes and no, right?
Okay.
I would say in that instance of it is again, very abrupt, immediate, life-threatening injury, obviously we're not considering this. But I'll also add, if you come to me, the physical therapist, for your neck pain, and then you go to the neurosurgeon for your neck pain, we are going to have two different approaches, and we're going to have the two tools that we use. And mine would be whatever techniques I use and exercises I use to get you feeling better. And the surgeon's is going to be some sort of surgical intervention, right? And so there, the doctor may look at your MRI or look at your x-ray and say, yeah, you definitely need surgery. This is why it's causing your pain. But only you will know, hey, my pain fluctuates. Some mornings it's a 2 out of 10. Some mornings it's a 9 out of 10. Or I can do certain things. Like if I bend my head down, it feels better. But if I look up, that really onsets my pain. These are all things we can use to discern, hey, one, obviously this isn't an emergency, right? You kind of been like living with this and we've slowly been dealing with it and it comes and goes and whatnot. Number two is all these little changes, the actual change in the pain or noticing some things that make it worse, better, whatever, are signs that we can definitely make a change. So with that, to answer your question, obviously, if it's an immediate life-threatening situation, we're not even talking about this. You need the surgery, whatnot. But depending on what type of healthcare provider you go to, they may say you need a surgery and you may not need a surgery, right? So I'm thinking like a disc herniation in particular. If you go to a doctor, or even like lateral foraminal stenosis, which is closing down of essentially where the nerve exits from your spine, and it can give you pain all the way down that nerve distribution. Those
And that
types
may
of things. Go
and
ahead.
that may not necessarily need surgery, right?
100% definitely may not need surgery. 100% may not need surgery. Now, a surgeon is going to likely say you need surgery, and a physical
Yeah.
therapist is likely going to say you need to do these things to be pain free, right? So it's
Right.
just kind of knowing your healthcare provider, and then being aware of if your pain is fluctuating, that's a good sign. It may be musculoskeletal, it may be mechanical, and there's small changes that we can do about it.
And so that's a good sign of possibly not needing surgery, right? If the pain
Yes,
fluctuates.
right.
Yeah, that's kind of what I tell my patients too. Like if the pain is progressively getting worse and it's not abating, then that's a sign that maybe, listen to your surgeon more than listen to, your physical therapist. As far as, well, your physical therapist will tell you to get surgery based on that anyway, right?
Yeah,
For the
I mean,
most part.
right.
Yeah.
And my whole goal with this conversation is to make you, the listener, more educated on just being aware of hearing my opinion, hearing your physical therapist's opinion, hearing your surgeon's opinion, and then you making the judgment call based off all this knowledge.
All
But
right. So all right. So let's say we have this where you don't necessarily need surgery based on your symptoms. I mean, are you implying that you may get results from going through the actual surgery protocols without actually doing the surgery?
yeah, exactly.
Oh, wow,
And
that's fascinating.
so that is more or less exactly what I'm applying. So where I originally heard this virtual surgery concept is from Dr. Stuart McGill, and he's like the physical therapist for back pain. Even though he's not a physical therapist, he is like the foremost expert. I think he's in Canada at the University of Waterloo. And he's one of the world's just foremost experts on low back pain. Really studies it, writes some great material on it. I highly suggest checking him out. But reading his book, he came up, or he at least, this was the first place I heard of kind of this concept of virtual surgery. And so I'm just going to read a few little excerpts from his book right now, just to kind of talk about what he's talking about with virtual surgery.
Okay.
So the first beginning of this page is surgery even for you? And he comes up with this essential list of things you need to know if a surgery is for you. So he says 95% of the challenging patients he sees do not need surgery, even though many of them were told that's their only cure. So that kind of speaks to what we were talking about before. He says, my opinion is based on 3 decades of experience working with patients who've been successful with surgical avoidance and in dealing with failed backs caused by unsuccessful surgery, which I have also seen. Yeah, and then he just goes on to talk more and more about that. He mentions surgery constitutes a rolling the dice. There is no undo button. Essential nerve and muscle tissue is cut. The scarring process that ensues sometimes grabs onto nerves, which is true, resulting in potentially chronic back pain. Essential bone is removed, creating a permanent loss. In these areas of the body, bone does not grow back. Yes and no, I agree with that.
Yeah.
And then he says surgery does work for some people, but beware, it may work for only a period of time. Studies show that initial progress may be made, but that after a few years, the surgical patient status is comparable to those who choose the non-surgical option. So I'm going to take a break right there and pause to speak about one of my patients. We'll just call him patient A. Patient A had a motor vehicle accident. He had his cervical spine fused at one segment, C6, C7. So now this cervical spine segment is fused. The 2 segments on top now are what is now, or on top and bottom, is now what is bringing him into me, because we created this really stiff, rigid structure at this one place. So now what do we have to do? We have to have more movement above and below to make up for this very stiff part of the kinetic chain that wasn't supposed to be that way, essentially.
Because those 3 vertebrae that are fused together aren't moving. I mean,
because now those 2 vertebrae that are fused together are not
permanent.
moving. Yeah, that's permanent. That's hardwired. That is caged in. There's a lot of different ways that they fuse them together, but that is permanent. There's no movement there, or minimal movement. And that's how we get this issue above and below, right?
Yeah.
And so patient A, is now, we've gone through a bout of therapy. Some things are getting better. This essential, very sharp pain at the level of the fusion is not going away. And to me, it seems like it may be some of the actual surgical hardware doing exactly kind of what this guy mentioned, where The nerve and the muscle tissue is cut, and the scarring process that ensues sometimes grabs onto nerves, resulting in chronic back pain. So this may be part of kind of the scarring down from that initial fusion. And it may even be like if a little bit of that hardware, like you can imagine, if a little bit of that hardware was too long and it's rubbing up against some piece of tissue, that could give
Yeah.
you a very sharp pain right
Yeah.
there.
That sounds painful.
So he goes back to another doctor, and the doctor suggests another surgery. We'll fuse above and below. So
So
that'll be great.
now you have 5 vertebrae fused, right?
So now, yeah, now you fuse C6, C7, you fuse C6, C5, and you've also fused C7, T1. So you've now created these very stiff segments.
Yeah.
And so he's coming to me saying that this is what the doctor is suggesting, and kind of what do we do here? And now just a little aside about this patient, and this is where you can kind of fill in the blanks of you, and see if this kind of relates to you. Patient is a long distance truck driver, spends a lot of time in a very bumpy, like 18-wheeler type truck. So if he
Yeah.
has neck pain, you can kind of imagine the constant potholes and just bumpiness. And I'm sure those 18-wheelers don't have the best suspensions.
Yeah.
So that
Oh, yeah.
constant bumpiness and poundingness of the road, and that's something he specifically mentioned, exacerbates his pain. So ding, ding, ding. We have something that he does that exacerbates the pain, and we have something we know we do that relieves the pain. And we know certain movements are really causing that C6, C7 level to bring out that sharp pain. So all this lets us know, hey, this is musculoskeletal, and this is something that we can make little changes of. If backward bending causes our pain, well, let's develop more forward bending or more forward posture, whatever the case may be, right?
Mm-hmm.
So the concept of this virtual surgery, and I'm going to go ahead and go back to Dr. Stuart McGill's book and kind of explain what virtual surgery is. So he says, before we do any rehabilitation, we are going to play the virtual surgery game. This means I will lead you through the recovery program of a surgery patient without actually going on under the knife. Today, let's pretend I gave you the surgery. This means that you will not go to the gym or stretch tomorrow. You will rest. We will very slowly and methodically build a progressive rehab program for you. The recovery program would follow the principles outlined in the book. They include erasing the cause of pain, establishing pain-free movements, walking, some specific exercises. I am convinced that some surgeries work for no other reason than they have forced the patient to take the time to rest. Always try this approach before going ahead with an actual surgical procedure. Many of my patients have done better than the statistical outcome for surgery by employing these techniques alone. So what he's saying there, and if, let's say, patient A, my example there, undergoes this cervical fusion surgery, what is he going to do? Well, he's going to spend a week or two in a cervical collar. He's not going to be driving in the bumpy truck. He's going to start going through a rehab process that's very slow, much slower than we're probably doing, and very methodical, and slowly developing the strength, the range of motion, the coordination, all the things we need to do to get strong and pain-free and move well. And all he's suggesting is let's try that whole surgical approach without the actual surgical intervention, which is completely erasable. There's nothing we can do to undo the cutting, whatever they put in there, all of that good stuff. And if we do undo it, we just have to cut more, which just is a second whole situation. Yeah. So most people, and I'm again we'll think of patient A here. My suggestion was him. Why don't we, and he's talking about retiring for the sake of this situation and whatnot. And I've suggested to him, why don't you consider surgery like you are, but let's retire or not go under the truck like you, or be on the truck, be driving the truck like you would, if you had this surgery tomorrow, you would be out of the work for a month at least, if not more. Take that time off. Be nice to your neck for the next 2 or 3 days. I always use the verbiage, be a friend to your neck. So if you know your neck likes these specific things, do things your neck likes. And then in 2-3 days after a rest period, begin to move educatedly and like with some coordination. and begin to slowly do what you would do if you actually went through the surgical procedure, strengthening the muscles we would strengthen, develop what we would develop if you went through the surgical procedure. Let's just do that without the surgical procedure. And very often you see identical, if not better outcomes than the surgical procedure. Now, again, this works in a very conservative management basis, general low back pain. This is not what I would suggest, like in those immediate kind of injuries where it's life-threatening. It's very obvious we're going to need a surgery to kind of put this together.
Yeah.
This is for your chronic achy shoulder, achy back. I think of herniated disc where they suggest clearing it out or fusing it, or I think of shoulder pain or hip pain where they say you have a CAM, which is like a osteophytic buildup that limits your ability to flex the hip or something like that. And the only way to get rid of that is by shaving it down. That's true, but maybe we can do some small things so you don't have to get that shaved down and you don't have the pain, you still have the hip mobility. So the whole point is consider this virtual surgery before undergoing a surgical procedure. Go through the rest period that the surgery would give you, because it gives you forced rest. You have no option but for 2 or 3 days to not do anything. That is doctor ordered, depending on what the surgery is. You may even be in like a brace. You may not even be able to move your neck for 2 or 3 days, depending on the surgery. So go through these periods of rest and allowing yourself to kind of recover and basically remove the insult, in which for my patient A example would be like driving in that bumpy truck. Then begin to go through the rehab process like you normally would if you had the surgery, and you're likely to get a very similar, if not better outcome if this is a conservative like pain that we're talking about, like a chronic low back pain again.
That's fascinating. I mean, I hear about studies all the time that say that it's dependent on what the surgery is, that the outcomes tend to be similar to not getting surgery with many people, depending on what it is, right? So that's fascinating. The other thing that I also find with surgery, not necessarily with like spinal surgeries or something, but I have a lot of patients who've had abdominal surgery, one form or another. And one of the big complications of that surgery, and I guess the way, and you alluded to this, is like after surgery, you get a lot of scarring, right? You can potentially, some people scar more than others, and it can really discombobulate all the structures in there, where scarring impinges on a nerve or whatever. I don't know if you remember this, but we did a pre and post surgery podcast years ago, it seems, but anyway, we talked about some woo-woo stuff that may help prevent the scarring, right?
Yeah.
And in my clinical experience, it certainly does seem to help.
Yeah.
Like doing the high dose bromelain, like post surgery, maybe you can add this to your virtual surgery protocol, and then maybe even that anti-scarring homeopathic thing. I mean, it's certainly, I'm all for any meds like that, especially if they're not going to do harm. And using what we call thios as an anti-scarring med may really help too. So maybe that could be part of that, virtual surgery. I mean, I put it a part of all my surgeries. I mean, I do a pre and post with my patients that are going surgery. So if you're gonna do a virtual surgery, maybe even make that part of it too.
Yeah.
But that's fascinating. And that speaks a lot to how the mind, kind of going through the process gets your mind right, to where maybe going through the process, there's a placebo effect where you've gone through the process, you don't even notice the pain after a while too. Maybe there's a psychosomatic component to that.
Well, and so maybe that's those first 2 days, right? When you're resting and you're not adding more insult to injury, and you're taking those 2 or 3 days to actually rest and let things calm down. And that is definitely what you're doing those first few days of surgery. And obviously with surgery, you're healing and whatnot, but just like you said, there may be I'm sure there is a psychosomatic component to that.
Yeah. That's really cool. I mean, it seems to me that should be part of your therapeutic order way before you even get to surgery.
Well, what's funny to me is patient A went to the surgeon, said, "Hey, my therapist talked about this virtual surgery option that I would like to try." Surgeon loved it. Probably the first time surgeons ever heard of that option. So it was just,
that's
it
very
just kind
cool.
of blew me away.
That's cool. Well, I would imagine, I mean, I, I don't know, any good surgeon, I mean, that's worth their weight in salt. I mean, they're not going to want to cut on you unless they actually, they know that there are issues with the surgery that can potentially be there,
Right,
So
right.
any non-invasive way to help, especially, even if you scheduled the surgery, let's say the surgery can't be scheduled before, I don't know, a few months out, which a lot of people can't get in to get surgery. Maybe go through that process, and maybe it will prevent you from actually going through the surgery. But
And
that's
the
cool.
Yeah, and the amount of people that I've seen who had a carpal tunnel surgery and it was really from their neck or so on and so
Oh,
forth
me too.
is astronomical. And so that
Me
speaks
too.
to,
Yeah.
if you take this virtual surgery route, you you can alleviate this without causing a surgery that you may or may not even actually need. And so just to wrap up, I do want to read from Dr. McGill's book here. And he says, when looking at surgery, consider the following. So these are the points, and they'll kind of wrap up what we just mentioned there. So he said, first, always try the virtual surgery approach and consider surgery only when it fails. Next, surgery should be considered when neurological issues are substantial, such as lost bowel, bladder control. It kind of speaks to what I was speaking about earlier.
Yeah.
Radiating pain symptoms, numbness, muscle atrophy, etc., are all signs of trapped or compromised spine nerve roots. And just to let everybody know, this book is specifically about low back pain. He is literally only talking about low back pain in this entire book.
Yeah.
So we have been successful in each of these conditions using nerve mobilization approaches together with mechanically based movement therapy. For the surgeon, what they would consider as an approach here would be like those nerve burning interventions where they literally just burn the nerve so you no longer feel the sensation.
Yeah.
Um, he says surgery may be considered in cases of trauma. Again, speaks to what I was saying earlier. Pain must be unrelenting and severe for a substantial period of time before surgery is to be considered. Patients who had severe pain for as little as 3 weeks and then have surgery have been some of the most disabled post-surgical cases I have seen. If you have a good day and bad days in terms of pain, you are not a surgery candidate. You need to identify the cause of the changing pain. Be aware of new treatments. Over 3 decades, I have observed many new devices that have been surgically put into people that do not meet expectations over long term. Discs have been stiffened with pain injections, heated with catheter to stiffen them, cored and screwed with various implants, to name a few. None of these lived up to their initial claims and expectations. And just as a little aside, that speaks to Mr. Patient A, where now 10, 15 years ago, he had C6, C7 fusion. Now we're dealing with the consequences of the fusion.
Yeah.
Is essentially what we're dealing with.
Yeah.
He goes on to name a few points, but always exhaust the conservative options. You may think that because you tried physical therapy or some other approach once and it failed, that surgery is your only option. There may be other therapies that may be more appropriate for you. This last point I really do want to mention. He said, be aware of the institutes that offer to view your scans, CT, MRI, and advise you that their surgery options without assessing you. They are assuming that the picture shows the pain and that they can cut the pain out. My science and experience suggests that in many cases, the pain is actually coming from a structure that looks fine on the MRI image, while the nasty looking disc is really pain-free. A surgeon must confirm
Yeah.
that the pain is indeed coming from the structure identified in the MRI. Having stated this, an MRI can sometimes reveal injury mechanisms through linking distinct patterns of tissue damage. My advice is to avoid a medical service provider who does not conduct an extensive examination on the patient. And that speaks to a few studies that have been done that look at completely asymptomatic, no pain having people, and they find disc bulges, herniations, degenerative disc disease, and all these things that should give you all these pains, and you're completely pain-free. So the image doesn't necessarily tell us you, because the image may be a static thing, and the pain is more so, if you go back to the very beginning, about if you move a specific way and it releases your pain or reduces your pain, or you move a specific way and it exacerbates your pain. This is mechanical. This is something that we can figure out, and we can kind of work through these painful motions, these pain-free motions, to develop good quality motion. And a very static image of your spine, for example, is not going to tell us what we need to see or need to know.
So as me being a primary care physician, definitely not a not trained in physical therapy, or definitely not a surgeon. The main key symptom or sign is that the pain waxes and wanes. There are times when it's good, where it's fine. There's times when it's bad, and that may be indicative of you that you probably don't need surgery, and that virtual surgery may be a tremendous benefit.
Virtual surgery with some education, right?
Yeah.
Because if you just lay there, we know for a fact that doesn't help, including with back pain and acute disc herniations. We do not suggest anyone does bed rest for longer than a day or two. And that speaks to, as you're laying down, the disc get more imbibed with fluid. And
right. So it depends on what the injury is, right?
well, you just definitely need to be guided along through the rehab process that you would do had you had the surgery. And you have to go through it well to ensure you're not causing a flare up and thinking this virtual surgery thing isn't for you. So just thinking about like a disc herniation, more often than not, if you backward bend with those, it increases your pain because it's kind of squishing the material against the nerves and compressing that area more. You may not know that and do more extension because that's what you read online that helps a disc herniation, which it does, but you need to do it in a proper way. And think this virtual surgery option is not working for you. And that is just not the case. We're just not moving. We're not moving how we should to cause the changes we're looking to cause.
Yeah.
So you definitely need to be guided along.
And who is the best guide? I mean, the best guide would probably be a physical therapist, right? I mean, I would say that, but well, that's what I'm thinking, because I mean, the surgeon is not going to take the time to do that. To
the best guide is a movement expert, right?
Yeah,
and that's a loose, unlicensed term or anything like that. But if one thing we're honing in here is if your pain is, you have good days and bad days, or your pain is caused by this, or your pain is relieved by this, someone that allows us to further investigate where the exact source of this pain is, not the image, the actual response to movement, because our bodies are constantly moving and fluctuate, and we just have to put stress where stress is supposed to go, and we should be pain free. So if we move intelligently and we go through a full examination of what is kind of exacerbating these things, then yes, someone with a high degree of knowledge in anatomy and movement would be one of your and rehab would be one of your best people to go through. AKA
all right, well, I'm plugging you, Bryan. I mean, it sounds like even some PTs may not even go there with this. I mean, but anyway, that's very cool. I mean,
yeah, if you're dealing with some pain, if you're dealing with some pain that comes and goes, waxes and wanes, you got good days and bad days, feel free to reach out on B.Well PT FL.com, or it's in the link, and we can schedule a consultation just to chat and see kind of what route you need to go. So I'm happy to do that. Any questions about that, Keoni? I just really wanted to
that's fascinating,
educate people on this concept.
That's fascinating to me because it speaks kind of to an underlying theme that we've had with these podcasts. It's like, think about your therapeutic order. What's the most non-invasive thing? I mean, damn. I mean, it's much less much less invasive than going through surgery. So yeah, I think that's incredible.
And you could go through surgery later. Like it will be there. Again, if we're talking about non-life-threatening things, my patient A could try this, till March of next year or whatever. And if it doesn't work out, okay.
Yeah.
No harm, no foul. Whereas if we go through the surgery, harm. It's done. I mean, for better or for worse, we're hoping to get the positive outcome. And I have every belief that the surgeon's hoping for the same thing, but we cut to get there, and we cut to fix it, and we sewed it back up. So not much undoing that.
Very cool.
So I hope this helps. And until next week, we will talk with you guys. And this gives us 2 episodes, Keoni. So if you're watching on video, we look the same.
All right, take care,
everybody. Be well.